I'm going to deviate from my usual biomechanics videos. This one is just going to be a little bit of dermatology, which is not my field, so I will be simplifying and playing fast and loose with the science here. Apologies to Belinda for that. But I just wanted to do something on corns type 2 verrucas and type 1 verrucas, just to try and explain the difference between the two, or the three, and how you can fairly easily diagnose them. So just a bit of a revision. Your skin's made up of lots of layers. I'm skipping a few. You've got your stratum corneum, that's your dried out skin, the dead skin, which sits on the top. That's something you can poke with a sharp stick and it won't mind. Then you have a somewhat thicker layer underneath it. That is the spiny spinosum, which you'll also hear described as the prickle layer. They are one and the same thing, it's just different terminology. And then you have a thinner layer under that. That's the basal layer. And then under all of that you have the dermis. So that's the dermis. That's the epidermis. The dermis is where you find all the blood vessels, the nerves, the erector pili muscles, the hair follicles, all the living bits. If you cut into the dermis, people say ow and bleed. If you cut into the epidermis, technically they shouldn't. Corns verrucas and type 1 and type 2 verrucas affect different layers of the skin, and they cause different presentations. So a corn will be mostly in the cornified layer, hence the name. It's a plug of hard hyperkeratosis which sits there. Because of that, it deforms the spinosum. It deforms the basal layer, and of course it deforms the dermis, and it's that deformation of the dermis which causes the pain, because of course that's where all the nerve fibres are. Generally speaking, as we all know, to remove one of those, all you have to do is get a scalpel and cut the plug of hard skin out, and all being well, that will bounce back to the surface and jobs are good 'un. Neurovascular corn is not dissimilar, except that you end up with little bits of the dermis getting interfered and mixed up with the epidermis. So you'll get nerve cells and blood vessels actually growing up into the corn itself. That obviously makes it phenomenally painful, and it also makes it damn hard to actually remove, because to do so you actually have to cut into tissue that hurts. There's a few ways that people like to get rid of those. I'm not going to go into those just now, but usually I tend to find that it's best to do that under local anaesthetic, and then you can still do the same thing. Now verrucas, the verruca virus settles and infects in the basal layer, this one here. That usually needs an interrupter, a microfissure in the top layers to get down there, which you can give yourself by walking around on the non-slip coating at swimming baths or by filing your skin. The virus affects the basal layer, and it causes hyperproliferation in the spinosum layer, so this layer. So if you have a type 2 or a mosaic verruca, what you'll find is that the dermis will be slightly deviated by the virus. The basal layer will also be pushed out. The prickle layer, the spiny spinosum, is the area with the thickening. That's where you've got the hyperproliferation. And then the cornified layer will sometimes also have a thickening on the top of it, because there's a higher area of trauma. So your classic type 2 verruca is not very deep. It doesn't make a particularly big impression there. It's more of a sort of an abnormality of that area, and they can be very, very broad, in which case they tend not to be particularly painful. A type 1 verruca, on the other hand, is an entirely different proposition. A type 1 verruca, the cornified layer will be pretty much common, perhaps a little bit thicker where the verruca itself is. But in a type 1 verruca, the spinosum is massively distended. This is the vacuolization. Basically, the cells overinflate. The individual skin cells in the spiny spinosum become huge. They become full of liquid. They're white. They're macerated. They look just like it does when you've been putting caustic on them. So they present completely differently to a type 2 verruca because this area here is so thick that you cannot see the dermis behind it. Usually your skin looks pink because what you're looking at is the dermis, but with this one, this is so thick and white you can't actually see the dermis behind it. Your basal layer will obviously then also be distended, and the dermis will as well. And sometimes it plays an even meaner trick, which is that it develops a helomadurum on the top of it. You will develop a big fat lump of hard skin on top, which of course when it all gets pushed down flat will look like this. So you'll end up with a big fat corn with the type 1 verruca underneath it and then everything else below that. You'll know that because when you remove the corn, the area underneath it will look white, and sometimes it will very often be very wide as well. It will be 3 or 4 millimeters wide. These here can easily be 6-7 millimeters deep. They are tremendously deep. Now, in terms of diagnosing these, there are a few tricks that you can do. First of all, your hard corn or your fibrous corn will not have this white appearance underneath it. If you get that, that is almost certainly a growth. When we treat them, if we're doing dry needling, it's the same with all of the verrucas. You push the needle through past the epidermis and the dermis into the fatty layer to try and push all of these viral proteins, trying to push the viral material into the bloodstream so that you get an immune response. Now you can do that with type 1s or type 2s. It works better, I have to say, with type 2s in my experience. There is another option with the type 1, which is that you can actually scoop the thing out. If you debride just a little bit of this hard skin, literally just take the top off, and then just a tiny bit through there. Oh, sorry, that's my type 2. Tiny bit through there. What you'll find is that this white lump will come out very much in one piece. It's not very tightly bound to the basal layer and the dermis. And when you remove that, the white tissue will come away as a single white lump, and what's left underneath will be pink tissue or red tissue. You can do that without fear of causing scarring, because provided you don't actually break the dermis, provided you don't break that red line, you won't get the scarring. So in terms of distinguishing the two apart, there are a couple of tricks you can do. This is your verruca, just to recap. That's the cornified layer, that's the spinosum layer with all the white, soft, vacuolized tissue. Then you've got the basal layer, the dermis and the fat. This is your corn. You've got your really thick, hard cornified layer, your plug of hard skin, the relatively normal spiny spinosum, basal layer, dermis, and into the fat cells. This stuff is white and soft, whereas that stuff is yellowy brown. That's what colour corns are, and it's hard. Hard corns are exceedingly solid. A trick you can do You give the patient an ankle block, which if you don't know how to do it and you're not comfortable with it, I warmly advise that you go to one of Belinda's courses and learn, because it's fantastic. With these, if you get a hypodermic needle, you take off the cornified layer. When your hypodermic needle hits that, it's soft. It's like pushing the needle through jelly. It's easy. When it hits there, when it hits the dermis, it becomes hard. And then when it comes through into the subcutaneous tissue, that also is soft. So that layer is soft, that layer is hard, that layer is soft. Whereas with a corn, whether it's a neurovascular corn or not, that layer is hard, that layer is hard, that layer is soft. So if you push a needle into a type 1 verruca, you'll get a little bit of resistance with the cornified layer, then no resistance for the verruca itself, which will be about 4 or 5 millimeters deep, then some resistance again, and then no resistance. Whereas with a corn, you'll have lots of resistance going through the cornified layer, and then that will go straight through into the dermis, so again, some resistance, and then it will get easier afterwards. So if you've got one of these white pappy lesions and you don't have the facility to send it off for culture, histology, all you need to do is numb the foot and stick a needle in it. If the needle goes through hard, then it feels really easy, and then it feels hard again, you've got a soft tissue mass. You've obviously got something soft in there. If it's hard all the way to there, and then it becomes easy to push in, you've got a corn or a fibrous corn or a neurovascular corn, or something where there is not this soft tissue mass. If you have the soft tissue mass, again, ankle block, and if you're confident to do it, scoop the little bugger out. So I hope this has been helpful. Again, apologies to anybody who knows better, which is most people, because I have made a little bit fast and free with some of the layers here. I've ignored some of them. But basically the difference between a fibrous corn and a type 1 verruca is that the type 1 verruca is a soft plug, the hard corn is a hard plug. And if you're not confident in terms of your visual assessment, and I have to say when you've seen a few of these, they are very distinctive, then get some anaesthetic into it and actually use a needle to probe it and to feel what the texture is. We probe ulcers all the time to determine their depth. You are not going to hurt either a fibrous corn or a verruca by sticking a needle through it. So this would be quite a useful pod hack, I would suggest.